Imagine a patient sitting in the chair saying, "These folds were already treated," and they came back again. Familiar? I hear it very often during consultations. In this episode, I'll show you a different way of looking at nasolabial folds. Not as lines to fill, but as a symptom of skin quality and tissue support. Work with the patient you'll see here began 2 years earlier. She already had PDO threads placed back then, which I'll talk about in episode 3 as a continuation of the therapy. Now she has returned with the same concern. So let's start with a key question. Why do nasolabial folds so often return, even though they've already been filled? Next, I make a guiding sketch, a gentle marking of the fold's course and the points that serve as reference during the procedure. This outline summarizes the 2 techniques I combine when treating the nasolabial fold: needlework and cannula work. On the upper right side of the screen, you see the stage done with a 22G 50mm cannula using the MicroBolus technique. Here, I inject a total of about 0.3 milliliters of hyaluronic acid, usually in 3 deposits of 0.1 milliliters each. This helps elevate the deeper part of the fold and improve internal support without risking vascular injury. Below that, on the same side, you see the needlework, 27G 13mm, in the soft dots technique. I use micro amounts of product, usually between 0.005 and 0.01 milliliters per puncture. In total, this stage gives around 0.25 milliliters. It's more superficial and precisely evens out the fold, where we usually see a thin indentation or a sharp transition between the cheek and the mouth. Combining both techniques gives the most predictable result. The cannula corrects depth, while the needle refines the surface line. How to draw the markings correctly? First, I draw a vertical line from the lateral canthus straight down. Then I draw a horizontal line from the lower base of the nose outward until it intersects the vertical line. This crossing point is considered a safe entry point for the cannula. It allows access to the subcutaneous plane and helps avoid key vascular structures. Next, from these initial lines, I draw another line along the oral fissure between the upper and lower lip. Then, from the nasal baseline to the line at the mouth, I trace the contour of the fold. This marks the natural path of the nasolabial fold and helps define evenly spaced cannula entry points according to its anatomical topography. If you enjoy this content and would like to watch the full episode, register for free on VOD Vismed Online and get monthly access to the latest knowledge based on research and real clinical work with patients. You'll find the link in the description and in the pinned comment. Additionally, with the code START, you can access your first month for a symbolic 2 in your local currency.